I'm broadcasting them.
Okay.
But let's,
Oh,
it's coming up.
Yep, now I got a lot.
Yeah, with that number climbing, I would probably, 7:02 or so, give folks a chance to get on, then go ahead and start.
Yeah.
yeah, I think we'll get started about 7:02 for everyone who's joined us.
There'll be some folks that's join us. They'll be coming in even a little bit later.
All right, Nico, you want to get us started here?
We are live. Ladies and gentlemen, welcome to tonight's Zoom meeting of the Medical Association to discuss this new grant program recently announced by Governor Kay Ivey to help medical practices with COVID-19 related expenses. Before we delve too deeply into that, we're going to look also at the results and survey findings from the Medical Association's COVID-19 Impact Survey of Medical Practices. Many of you participated in that survey, and it's important because the results from that survey really served as the foundation for the recommendations that came out of the Medical Association related to COVID-19. So let's look briefly at our speakers for tonight. Dr. Medical Association, Government Relations and Public Affairs Department. Trace Czar, also with the Medical Association, Government Relations and Public Affairs Department. And last but not least, the gentleman we probably all tuned in tonight to learn and hear from is Mr. Kelly Butler, who is the Director of the Alabama Department of Finance. Tonight's agenda, Dr. Meggs, would you like to say a few words?
Sure. Everyone, welcome. Appreciate you taking the time to join us tonight. Hopefully, we'll have a chance to hear from State Finance Director and learn more about the new grant program. The Medical Association did the survey on the impact of COVID-19 on our practices. I think some of that information was very useful in helping the governor decide that some of that CARES Act money should go toward helping out distressed practices. So really, I don't want to waste any more of your time. I'll turn it back to Nico. But again, thanks for joining us tonight, and hopefully we'll have some good information for you. Nico.
Thank you, Dr. Meggs. We're going to run quickly through the key findings from the COVID-19 impact survey, and then ultimately the public policy proposals that we identified, and then talk about the new financial relief funds for physicians that were made available in this new grant program. We'll end with a Q&A with State Finance Director Kelly Butler, and I will hand it over now to Trace to go over those key findings.
Thanks, Nico. And so as we start here, like Dr. Meggs and Nico said, the key findings from the survey and really the findings related to the financial impact of COVID-19 are what generated and kickstarted our advocacy with the governor's office and the finance department in opening up these new funds for physicians. I won't touch on all of these, but just wanted everyone to kind of see the overall highlights of our key findings from this survey. And as we look specifically at the financial impact COVID-19 has had on Alabama medical practices, I think the first percentage there is kind of striking in that nearly 60% of Alabama medical practices and respondents to our survey said that their revenue decreased by at least 50% during the shutdown. But on top of that, one of the other crucial things is that they actually experienced an increase in expenses. And on average, the amount of expenses that Alabama medical practices incurred for things like PPE or setting up telemedicine were almost $13,000. And so those two things are really what led us and kickstarted us to get here today. Just to briefly touch on some other findings for the survey, I think it was surprising to see just how little of Alabama medical practices used telemedicine prior to the pandemic. And you can see there with 88% saying that they actually offered no services. Now, key to telemedicine and whether or not it remains is going to be the reimbursement rates. And Nico will touch on that in just a minute. One of the last things from the survey was the lawsuits and liability, with more than 71% of respondents saying that they were concerned about potential lawsuits based upon whether it was their lack of PPE, cleaning supplies, medical supplies, or the delayed care, whether voluntarily or required. And so all of these things led us into some public policy proposals that have been undertaken in the past few months, and Nico will hit on those briefly.
Thank you, Trace. I appreciate that. It goes without saying medical practices are keystone businesses. They are healers in their community, they're economic engines in their communities, and their vitality and continued growth is critically important. What follows are 4 proposals that came from the data coming from the survey. And these are the high points. So we really looked at this information and said, what are the issues that the physicians across Alabama have identified as problems directly related to COVID-19, and what can we do as an association then to try and move the ball forward to address those issues? So the first for those, obviously the PPE shortage that came about early on in the pandemic and in many places continues off and on. So the association did set up a PPE program for its membership that was very successful. We continue to look for opportunities with other partners and organizations and groups and keep an eye on the existing issues and maybe local shortages that might take place to find new opportunities. But this was a real high point, was the PPE issue. Moving on to the second high point of this was enacting safe harbor liability legislation. Now, right now, medical practices and physicians and their staff are protected via Governor Ivey's executive order back in May. But really, to get a full spectrum protection for medical practices and physicians and staff, we need to enact a piece of legislation that's been drafted by Senator Arthur Orr. Now, Senator Arthur Orr is the tip of the spear on this issue at the legislature, and he's worked very closely with us in drafting legislation that will protect medical practices, not only from COVID-related claims, but from any activity during the COVID pandemic that affected medical practices' ability to deliver care to their patients. So we will continue to work on that issue moving forward the next time the legislature gets in session. The third key point, as Trace mentioned, telemedicine. Probably nothing saw such an overnight change during this pandemic as the telemedicine takeoff. There are really three critical issues that the Medical Association continues to advocate on in relation to telemedicine, and primarily discussing with not only government payers, but really Blue Cross Blue Shield of Alabama. And really the key issue there is maintaining parity for payment. So in-person and telemedicine services, maintaining that parity, making sure that's available to all physicians that are in a network, and then ensuring that patients have the ability, irrespective of their ability to access the internet for video conferencing, but to be able to access telehealth in the event they don't have access to internet for video. So those are key issues that we continue to advocate on moving forward, and we're continuing to look and see where that goes from here. The last issue, really the fourth key recommendation from the survey data was and is the subject of tonight's discussion. So the funding provided through this new healthcare grant program, it was announced last week by Governor Kay Ivey. We're thrilled to have seen this come to fruition. We appreciate very much the Ivey administration for taking this so seriously, for recognizing the gravity and the seriousness that medical practices have faced during the pandemic. And with the finance office, Mr. Butler in particular, we're working with us and identifying ways to make this program work moving forward. And so I won't be able to do the details of the program justice, but we are very pleased and happy tonight to have Mr. Kelly Butler, who is the state finance director, on the call with us tonight to explain this program and to answer your questions. Now, as Mr. Butler moves into his discussion and explanation of the program, if you have questions about anything that he doesn't cover or maybe a clarification point, please use the Q&A function within this Zoom webinar. We will, at the end of his discussion and presentation, we will then look at and cover the Q&A portion to make sure that we're covering everything that everybody needs. And so with that, Kelly, can you hear us? Are you with us yet?
I am, Nico. Can you hear me?
Great. Thank you, Kelly. We hear you and see you. Thank you for joining us tonight. We appreciate you taking a Thursday night to spend time with Alabama physicians and medical practice managers.
Absolutely. Glad to do it. And thank you, Nico, for having me on the call. Good evening, everyone. It's good to be with you. I am Kelly Butler. I am Governor Ivey's Director of Finance, and I'm here to talk about announced just last week. This particular grant program is specifically for healthcare providers, emergency response entities like ambulance providers. And so it comes after our other grant programs that have completed, including the Revive Alabama Small Business Grant Program that some of you may have been able to take advantage of. Just to details of the program, all of these grant programs are funded out of federal dollars allocated to Alabama under the CARES Act to something called the Coronavirus Relief Fund. And so our office has established a website, crf.alabama.gov, that contains all the details about what we've done with that money. And specifically to this grant program, there is an icon on the homepage of that website for this grant program, and it's labeled Healthcare and Emergency Responders Grants. So if we don't cover something here, or you don't get your question in, you can go there and fill in the blanks. And of course, we have a dedicated email address and where you can call and also or email and get additional information. So to this particular grant program, on the screen you can see the entities that are listed, and I will tell you we did our best to list all of the different entities that we thought we could, but there will be on the application, once it's up and running, an other category that you can fill in if you're not here in one of these, but you feel like you qualify as a healthcare provider or an emergency services provider. There is a fill in other category if we haven't covered your particular category. On eligibility, I want to point out that this is a business reimbursement grant program. So you need to have your own entity, your own separate employer identification number, or if you do it as a sole proprietor, an SSN that's associated with that business. So we've had some questions from physicians or other providers that are solely and only employees of another provider or in a hospital or a nursing home. And this program will not be eligible, or you will not be eligible if you are an employee only. You have to have your own entity in order to be eligible. I need to point out here too, something that Nico asked me this afternoon. Under this program, you are not eligible if you got a grant from our Revive Alabama program earlier. So if you already got a grant from that program, you're not eligible for this one. So on eligibility, I think that covers the main points. The coronavirus relief funds have to be used for expenses that were incurred on or after March 1st of 2020 through December 30th. Of course, this grant program is running in October, so you won't be able to go all the way to December. But the main point here is any expenses prior to March 1st do not qualify. And Nico, let's see. I'll point out here also that this is an expense reimbursement program in accordance with the federal guidance. But business interruption expenses, we're allowed to reimburse for the time period when you either had to stop seeing patients or greatly reduced patients during the height of the health order and the stay-at-home order, when many procedures were curtailed by the governing boards. So if you continued to pay your salaries of your employees while you were not receiving patients, if you continued to pay rent or mortgage or other utility expenses during that time period, then those will be and are eligible expenses. Finally, here, some providers receive direct monies either through the Paycheck Protection Program or EIDL loan, other types of federal assistance. If you receive that type of federal assistance, the mere fact that you received it does not disqualify you from this program, but you will need to have expenses that are qualifying expenses that have already been reimbursed by those programs. So for example, if you have $100,000 of qualifying expenses and you've already gotten $90,000 of other federal assistance, then you would be eligible for $10,000 from this program for those non-reimbursed expenses. This grant will open. The application is a online, fairly simple grant application. Opens on noon on October 5th. We're using a software program called Submittables. There is a link on that healthcare link on crf.alabama.gov to that website. You can see how it looks. We are running several programs through that website, so you will see different programs already listed. At noon on the 5th, there will be a link so you can start applying for this particular grant program. You need to have your own tax number. So if you are part of a practice that might have locations in many parts of the state and each one of those has its own tax ID number, then you can apply for grants for each tax ID number. Unfortunately, it's driven by that. So if your locations are all under one tax ID number, it's going to be one application. This is a grant program, not a loan program, so no repayment unless you make a material misrepresentation on your grant. We reserve the right to ask for the money back for those kind of things, which we don't expect to happen, but it is not a loan program. The application itself will ask you for your bank account information. Your W-9 will need to be uploaded. Some of you may already be receiving payments from Medicaid or other state agencies. but we will need you to reinsert that information. We're in a separate distribution system for these grants from the centralized state accounting system. And re-entering that information is required, and we'll ensure that your money gets to you more quickly. All payments will be made electronically, no checks. And in the case of incomplete applications or missing information, if you submit your application and have forgotten to include a line or forgotten to include a little bit of information, we will reach out to you. That will not disqualify you automatically. You will be given a chance to get information in a time period, 48 hours. And if you do that, your grant will stay in consideration. So Nico, I think those are the main points. I'd be glad to answer questions.
Let's start with one, Kelly. I had emailed you earlier in the week. I had heard from a number of ER physicians who don't necessarily maintain an office practice, and they were talking about, and they're not hospital employees. I mean, they are, in private practice, they just happen to be in ER medicine. Could you kind of go over that answer that you had given me at that time? Because they're not specifically listed as eligible here, but I think that other category is probably where you're going to say they should fill in.
That's right, Nico. Thank you for reminding me. If you're not an employee, and we're going to kind of use the same determinations that are made under tax law about whether you're an employee or a contractor situation. So if you're not an employee and you're that ER physician and you either have a business entity and a federal ID number, or you do it under your Social Security number, you will be eligible. You'll need to indicate, as Nico said, you'll click the other box and indicate your status as that type of healthcare provider, and that will definitely be eligible, an eligible provider.
All right, so some of the other questions are kind of starting to roll in, so we'll start at the top. Are medical billing offices eligible for this grant?
Nico, that's not one we've talked about. So rather than giving a direct answer right now, let me check into that one. It's a healthcare provider. Mm-hmm. That's part of the operation. If it's a separate entity, we'll certainly consider that. But I'll nail that down with my team in the morning and get you an email out on that one.
Yeah, and maybe there's some FAQs that have been put together on some of this already that we can help supplement as some of these more nuanced questions kind of come in, either through tonight's discussion or by email and things like that.
Okay.
So we've got this question, and I think you may have touched on this already. What if I got a PPP loan that covered most but not all of my expenses? Am I eligible?
Yes, you are. If you have expenses that are greater than you are, yes.
Okay. All right. Here we have a question from a physician who does not own the practice, but the practice owner's got an SBA loan, and he is an employee, but he did not get any financial support as a physician, and hence saw a significant income drop. Is there any eligibility for him?
So based on assuming that he is an employee,
mm-hmm.
Then I think the answer is no. If he's got a separate business entity that he operates under, then he could be eligible.
The key point I continue to hear you make is that business entity, that EIN, is really the driving force, it seems like, in these determinations.
That's correct.
All right, let's see. I have a question here. Let's see. It says $15,000 per each provider can be applied for. Does this include nurse practitioner? I think you're probably going to tell me the answer to that is it's not necessarily per provider, but it's per EIN. And however the structure there lies in. Is that correct?
That is correct. So if they have a nurse practitioner entity business, then yes, they could apply.
Okay. Here is another emergency medicine question. We are an emergency medicine practice. We paid our APCs as close to full-time as possible despite significant volume losses. Does this account as an expense?
So I'll need some help on what an APC is.
I'm thinking that is advanced practice clinician. I'm expecting that maybe what that is. So say a nurse practitioner or a PA that may work there, but I think it boils down to basically paying employees. And then during that time of say shutdown, would that qualify as an expense?
Yes, that would be business interruption expenses if they kept the people on payroll and then did not have a PPP loan or other federal money to cover it. Yes, that would be a qualifying expense. And Nico, this might be a good place for me to tell you that, I'm sorry for interrupting you. We're not going to require applicants to upload documentation of these expenses. However, we expect them to retain that documentation in the event that a federal auditor comes in and wants to look at it. But you're not going to have to get it all uploaded into the system. I should have said that earlier, and I thought I'd say that now.
So provisions of stacks of receipts are not going to be an element of the application process.
That's right.
Okay, very good. All right, here's another question. So what if too many people apply, the money runs out, first come, first served, question mark?
Right, so we've allocated 35 million. With all of our grant programs, we allocate an amount and then do the application process and just sort of reevaluate. We have additional monies available that we could allocate if enough qualified applicants, enough entities qualified to where we would exceed the 35, Nico. So we would do our best to fund all qualified applicants.
Gotcha. Okay. Another question here. So for COVID screening, we had to hire an extra person to perform those screenings. Would that salary be a covered expense under the program?
Yes, if you can document, if you have documentation that you hired them directly to do COVID, absolutely. That's an expense.
All right. Another question. Certain items are not covered by PPP loan. For example, certain utilities, medical equipment needed, and PPE. Is there a list of items covered?
So on that website that I mentioned, crf.alabama.gov, there are a list of eligible items, including PPE. I think certainly medical equipment would be covered. There's a list on our website. There is also a link to the federal guidance, which has some examples in it. We try to give guidance on everything that is clearly eligible, but that doesn't, if it's not on the list, does not necessarily mean it's not eligible. So if it's in the gray area, please either submit an email or call that number to get an answer.
Okay. All right, here's another question that I think is probably going to be related to the structure of the practice related to the EIN, but our practice has 2 physician owners and 6 employed providers. Are we able to apply for all 8 providers or just 2 owners? I think it would kind of boil down to how they're structured and if everybody has their own EIN, right?
That's right. So if the employees are employees, probably not. The owners have separate ownership. It could be 2. If they're joint owners, it might be 1. It's going to boil down to the EINs. Yeah,
it's going to be the tax structure of the business entity is what is the consistency there.
That's right.
Okay. A real similar question: 2 physicians, same practice, are both eligible, or just the practice? Again, depending on whether if they each have their own EIN or if the practice is under one employer identification number.
That's right. Same answer. Yes, sir.
I see a question here about email address to apply. We will post all this information on our website as well for the application process, the link to the website, and it is, as Kelly said, a pretty straightforward and clean website, and the application process should be pretty smooth. All right, here's another question. Will expenses through November qualify even if we apply in October?
So we would prefer that you go ahead and base it on expenses you've already incurred. However, expenses you pay through December are qualifying expenses. So that's not a direct, I'm not trying to dodge the question, but at the end of the day, you need to have in your files documentation that you had expenses between March and December that cover the amount of the grant, if that answers the question.
Yeah, I think it does. And we will be putting together, as I mentioned earlier, we have an FAQ page already, and we're also going to be adding more material to that based on tonight's call and any other guidance that you and your office have been so kind to spend time going over with us. Let's see, expenses can be accumulated through 12/31, so can future expenses used towards the qualifying expenses for Alabama qualify? I think that's kind of the same question.
I think it's the same question. I would point out, we can't go beyond the end of the year. So that's to cut off at the end of the year.
All right, so here's another one. So we did get a PPP loan. It didn't cover the total amount we paid mid-level providers despite the volume losses. Does that mean that we can apply for funds? The answer would be yes, right?
That's yes.
Yes.
Yeah.
All right, here's another one that came in. Will we be required to upload 2018 and 2019 income tax reports?
We don't need your tax returns. We will need a W-9, which is a form that has information on it that we can report for tax purposes to IRS.
Right. And we appreciate you making that process simple for the applicants. When will funds be dispersed? Kelly?
The application period closes. Can you hear me?
Yeah, I can hear you now. You cut out there for just a second.
The application period,
process.
it runs for about 10 days through October 16th at noon. As people submit applications, we have a team of people that are reviewing them. We don't wait till the period's over. It depends on how long it takes us to get through them. We didn't, because of the dollar limit, we like to get through at least as enough so that we know we're not running up against the dollar limit. And we make disbursements. And in our other grant programs, it has been about
losing you. In our other grant programs.
In our other grant programs, it's been about 3 to 4 weeks. I think I've got some internet issues at home here. I'm sorry.
That's okay. You're a candidate for a broadband expansion for certain.
I need one of those broadband grants. I would guess mid-November is a good target for when the money would absolutely be out.
And so the process, the application process is all electronic. So will the disbursement of those funds, will they be an electronic payment or will it be a paper check that arrives in the mail?
No, they're all EFTs. They're all electronic.
Okay.
You will get an email notifying you that we're making the transfer to the bank account that you provide.
All right. Here's another couple of questions that have come in. Are malpractice premiums eligible expenses?
Haven't had that one, Nico. I would say not your normal, nothing you were paying prior to COVID would not be eligible. Your normal malpractice. If you have had an increase directly tied to COVID, then that's a maybe. Could be a covered expense.
All right. Another question here. If you are a PC with a single practitioner, do you qualify? I think the answer would be yes.
Yes.
And you would be encouraged to fill out your application.
That's correct. Yes.
All right. This one, this may have been answered earlier, but I'm going to ask it anyway. Are salary expenses of employees after the PPP loan timeframe covered by this grant? So are salary expenses of employees after PPP loan, are those covered and eligible?
So salary expenses are eligible. You can. It's my connection. I'm sorry.
That's all right.
If you continue to pay employees while you had lost business, had lost patient revenue, then that's eligible. So if the PP loan ran out before you were able to get your patient load back up, then and continue to pay them during that time period, that would be the eligible part.
Gotcha. Okay. All right. Other questions for Mr. Butler for tonight regarding the program? It's the eligibility requirements, any of the time frame questions. It will open Monday at noon, right? And
Monday at noon.
Monday at noon. And all applications will be made electronically. The funds will be EFT dispersed. You said probably a 3 to 4 week time frame, something like that. And one of the key drivers seems to be business structure, tax structure, EINs. How is the individual practice set up? If everybody who's a partner has their own EIN, then you could have every partner apply. But if everybody's under one umbrella, then that would change that application to be more singular. And then also, all right, that's another question on the web address. We will have the website address. Trace, is that on the screen right now at present? I believe it is.
So what is on the screen at present is the
Yes.
website where you will go to on Monday
Mm-hmm.
to submit the application itself.
Right.
There are other links in terms of the FAQs and various links to whether it's Governor Ivey's description of the program or the finance department. But this link in particular that's on the screen is the link that you will go to submit the application.
Okay. Very good. That's alabama.submittable.gov. So for those joining by phone who cannot see that, that's the Alabama spelled out .submittable, SUBMITTABLE.gov, alabama.submittable.gov. And that will be in our email communications as well. I have another question that's come in. Let's see what, if you received PPP loan which didn't cover the physician's salary fully, do you qualify for this grant?
So Nico, I think it's the same answer.
Yeah,
You know,
I think so.
If you were paying that person and not getting revenue.
Mm-hmm. And you would encourage anyone that has any specific questions regarding any of the, as you said, kind of the gray areas to reach out to your office. Would that be the best way to handle that through the process? But to look at submitting those kind of expenses, that anything COVID related, any kind of salary changes or I guess life support for a practice during that really critical time in those crunch months of March and April and really even into May to some degree.
I think that's right. I would focus on those months, March, April. That's where you're most likely to have those expenses. And if you can get up to 15,000 just in that time period, then you don't have to worry about the rest of the year.
Mm-hmm. All right. Any other questions? Oh, here's one that just came in. Here's a question. Expenses are eligible so long as they were incurred while patient revenue was down, ? I don't necessarily think that's what you're saying.
No, so some expenses are eligible only during that time period, like
Mm-hmm.
salaries, but ongoing expenses of PPE or, you know, whatever you have to do to prepare for COVID patients, even when your patient load and your revenues back up, those will qualify. It doesn't have to be just while you didn't have revenue.
Basically, anything that you spent money on for COVID that you probably wouldn't have done anyway. And whether or not revenue was down or continues to be down or not, those are all potentially eligible expenses that someone could turn in on the application process.
That's right. And
Okay.
Especially for the healthcare community, the Treasury guidance has plenty of eligible expenses. So, you know, we don't expect it'll be too difficult for most people.
All right, so here's a question about what documentation is needed with the application. I think you said the W-9 would be the start for that, and then filling out the actual application that's on the website. Is that correct? But no receipts, none of that kind of stuff.
That's basically right. Yes. We'll need a bank account information. We ask for a voided check or a bank note, something that lets us know what your routing number is. That's about all we'll ask you to upload. There will be questions that you'll have to answer, and you'll have to certify that you have eligible expenses, and you have to certify that you haven't already had those covered by other federal monies. But that'll be a question answer kind of thing, Nico. Not a bunch of documents you have to upload.
Right. All right. Very good. Another question that's come in. Is this grant taxable as income?
So not taxable for Alabama income tax purposes. And I don't believe it's taxable for federal tax purposes. It's a grant reimbursing you for expenses. I'm not a tax advisor, but
Yeah.
so I would check with your tax advisor to be sure, but I don't believe it is.
Right. Well, it looks like we've got one more question. We're going to have time for just a couple more and let Mr. Butler have the rest of his evening back. I added 2 providers and my revenues for the EIN are not lower this year compared to last due to additional providers. Do I focus on expenses since I don't have a loss compared to the prior year?
I think this is a yes. You wouldn't have necessarily business interruption costs, although you possibly could, but you would definitely have expenses. I would focus on that.
Okay. And as a reminder, folks, we're going to add to the existing FAQ that's on the website, alabamamedicine.org, and we will upload, answers to these questions as well. So let's do a last call. If anyone else has any remaining questions, we probably have time for maybe just a couple more before we let Mr. Butler go. And Kelly, again, how much we appreciate your time tonight and your work on this project.
You're welcome. I'll be here as long as you need me.
All right, last call for questions. I think, again, the high points I keep hearing are EIN, practice structure. You can really be able to submit 1 application per EIN is what that boils down to.
That's right. And if you're unsure, go to the website, send us an email, give us a call. We are trying to work with people as much as we can.
Great. Let's see. We've got some thank yous that have come in. Thank you, folks, for your time tonight. We appreciate everybody. Kelly, you've got some shout outs and some appreciation. You're in a position where you have to field a lot of complaints, but I don't know how much praise you get. But we want to praise you and we thank you for making the time with us tonight to go through this process, because, as you said, medical practices have been hit so hard during this and have been hit really from both sides. And so we appreciate you making time for this tonight. Appreciate you dealing with our questions leading up to this and preparing for this discussion tonight. And just thank you. Any parting words you'd like to leave? Any other elements that have maybe come to mind or that we haven't covered that you want to mention?
No, I'd just like to say thank you for letting me do this. I do my best to answer them. I've got a team of great people that are working on this that I need to give credit to. And they are more knowledgeable than I am, so you might get a better answer talking to them. And Nico, I just also want to say we know this is a relatively small amount of money, but the governor wants to help as many people as she can, and the CRF funds. If you browse that website, you'll see a whole array of different things that have been done. And that's kind of our world. We're trying to get the money out to as many people as we can. So
we appreciate it. And thank you, the governor, for making this a priority. We appreciate very much, like I said, your time tonight. And, this whole conversation kind of started, we put this survey data together and reached out to you, several of us in that discussion at the Medical Association about we've got a real problem and a need here. We have the answers. We have the data here about the issues that we've got. Can you help us? And the answer from the Ivey administration was yes. And you have put this into the wheels in motion on this. And we really appreciate that. And thank you to the governor and thank you to your office. And I will echo that you do have a great team, but they've also got a great leader. And so thank you for your time tonight, Kelly. And we will let you have one more question. I thought we've got one more that's come in. What if the mid-levels are employees, but rather are not employees, but rather independent contractors? I think they would probably have their own EIN, and so they would be eligible there, right?
They will, yes, if they're independent contractors operating separate from an employee status, yes, they should be able to apply on their own.
Okay.
They'd need to have qualifying expenses separate from the business, but
certainly. Great. Well, we will again, folks, take all these and put them into our FAQ that's existing on the Medical Association website, alabamamedicine.org. And again, the website for the program is alabama.submittable.gov, and that will launch Monday at noon. So again, Kelly, thank you. We're going to let you get out of here before any more questions pop up, so you can have a little bit left of your Thursday night. But again, sincerely appreciate your time tonight and your work on this project.
You're welcome. Thank you, Nico. Appreciate it.
Thank you.
Bye-bye.
And ladies and gentlemen, thank you so much for your time tonight, for spending time with us tonight to go over this information. It's what we do. We are, the largest organization representing physicians and practices in the state, and this is what your dues go for. I mean, this is the work that we did. We put together. You gave us the data from the survey information. We took that, crunched it, said, okay, these are the high points of where everybody agrees. So we're going to try and take those and come up with some action items and then roll those out. And as you see from the report we went through right before we went into the grant program explanation, we've really come good on those issues, and we're continuing to work. We're not through yet with those, but we've made progress. And so we appreciate your support. We cannot do this without you. Without our members, we really are not an organization. We won't have an organization. So I continue to encourage y'all to continue supporting us. If you want us to stay here to continue working for you and doing these kind of things and projects and being able to advocate for medicine in the state, we cannot do it without you. So I will bid you good night, and we'll thank you again for your support. And if you have any questions on the program, you can reach out to us by telephone 334-261-2000 or rotunda@alamedical.org, and we will connect you with the right folks to answer the questions. And please, everybody, get your applications in on Monday. Good night, folks. Thank you.